How does the governor's plan differ or compare to what you guys have been working on in your districts?
I think I'd like to see if Ryan Spain would like to address that.
Thanks, Leader. This is Ryan Spain. I live in Peoria and represent the 73rd District. I can tell you that the governor's plan that we first saw yesterday, it doesn't play in Peoria. And it's not because I disagree with the plan or it's not exactly what I would like to see, but the plan itself really is not workable for the type of efforts that we've been undergoing as a community. So let me give you a few examples. You heard from Leader Durkin that the regions established, which are the collapsing and joining of several EMS regions throughout the state, really has been conducted in a very arbitrary way. The healthcare data, the hospital system data, and catchment geography isn't reflected in the zones as proposed by the governor. And so these arbitrary designations really create problems for communities that are trying to move forward at a truly regional level based on hospital utilization patterns. And it gives further incentive to communities to just go it alone and not follow a compliance for what would be a more thoughtful regional plan. So that's the first problem, the arbitrary designation of regions. Number two is data. And so regional plans need to be developed using the very best scientific data, healthcare metrics. And I agree with many of the metrics that are actually included in the governor's Restore Illinois plan. The problem is we need to allow regions to move forward based on their current conditions within those data sets. So in my area in Peoria, we are already meeting positivity being well under 20%. Ours is well under 10%. Our hospital admissions are stable. We are maintaining a greater surge capacity for ICU beds, even than what the governor has called for in his Restore Illinois plan. And the issue is, while we're meeting all of those data markers, we have been meeting them now for the last 4 weeks. So that takes me to the third problem, which the arbitrary establishment of some of the time periods included in the governor's plan. May 1st was not a special day in Illinois where we all celebrated our transition into phase 2 of the Restore Illinois plan. It was simply a day where executive stay-at-home orders were extended and some mistakes that had been implemented previously were corrected, like the closure of garden centers and the closure of certain state parks in regions where it didn't really make sense. May 1st was not a special day, and May 1st shouldn't be the day that we all begin measurements now going forward in the state of Illinois. We have all been making measurements for a long time. We need to let the data and the scientific methods and hospital utilization patterns drive how we can truly move forward in a regional process going forward throughout the state.